Okay, let's get started. So I'm Christine Wagoner, and I'm the president and founder of the Cure GM1 Foundation, and I'm really pleased to present this effort to hand it over to Gisela, the head of patient advocacy from Azafaros, who will make an intro, and then we'll hear from Dr. Hastings. Thank you, everyone.
Thank you, Christine. Dear all, thank you for attending this webinar organized by Cure GM1 in collaboration with Azafaros. My name is Gisela Lindhorst and I'm the head of patient engagement at Azafaros. The goal of this webinar is to inform the GM1 community on PRONTO, a prospective longitudinal study of neurological diseases in children with GM1 and GM2. So it's a national history study. We are looking forward to inform you during this webinar and answer the questions you may have. Before we start, I would like to inform you on some housekeeping aspects. On the request of Cure GM1, Dr. Hastings from UCSF kindly offered to present the PRONTO study to you. We agreed with Dr. Hastings that she will present for 5 or 10 minutes. After the presentation, there will be sufficient time for questions and extra information. May we ask you to hold your questions during the presentation and ask them after the presentation. If you prefer to put your question in the chat box, please do so, and we will refer to your question also after the presentation. This webinar will be recorded and put on the Cure GM1 website for re-listening after in a later stage. The sole intention of this webinar is to inform you on the PRONTO study. The decision to participate is between you and your care team. If you may be interested to participate, please connect with your care team or referred PIs. And now I'm happy to introduce Dr. Hastings to you. Dr. Hastings is a hematologist, oncologist, and a neuro-oncologist at the University of California in San Francisco. She earned her medical degree from the University of California, and Dr. Hastings has a special interest in research in rare diseases, as includes projects on relapsed leukemia, brain tumors, and Niemann-Pick type C. She works on clinical trials for drugs that show promising treatments for also Niemann-Pick C. Dr. Hastings, the floor is yours, and thank you so much again for presenting this session.
Thank you, and thank you for this opportunity on behalf of Cure GM1 and Azafaros to speak with the community today. So I'm going to be providing an overview for the PRONTO study, and PRONTO is an acronym for Prospective Neurologic Disease Trajectory Study. So as mentioned, this is a natural history study. There will be no investigational drug that is being tested or monitored. We just want to have a better understanding of how GM1 and GM2 evolve in a subset of patients. So there will be a number of data collection sources that will focus on the neurologic manifestations of the diseases, in particular the late infantile and juvenile forms of GM1 and GM2. And these will be collected at various time points so that we can have a better understanding of how the diseases evolve in these patients. This will be a multinational study. It's going to take place in 6 countries at 13 different sites. And to date, there have been 22 patients enrolled. And the recruitment period is continuing through June of this year. So these are the sites that are currently enrolling. And as you can see, there are multiple sites in the US and in Europe and in Brazil in particular. And 22 patients, as I mentioned, have been enrolled. And these are the investigators that are participating in the study at this time. So this is some preliminary information that has come from the study. This is relating to the demographics or the baseline characteristics of the patients. And GM1 is represented in purple and GM2 is represented in green. And as you can see, there are, we're looking at distribution by gender between males and females, and also age of onset, late infantile, with symptoms occurring between 1 and 3 years of age at onset, and then the juvenile forms of the diseases. And this is still very early in collection, so it's a small group of patients, but you can see right now the approximate distribution. We're also looking at the age distribution of the patients. And these are, you can see that to date so far, that the patients with GM1, which represent again the purple patients, appear to have neurologic onset before 5 years of age, with a higher delay in the diagnosis of GM1, so we can see that longer distribution. And there appears to be about a shorter delay in diagnosis or from age of presentation in the GM2 patients at this time. Again, this is a small cohort so far. We hope with larger numbers of patients that we can have a better understanding of this. So the PRONTO study was designed following the advice of the regulatory agencies in the US and internationally, as well as discussion with the international expert and patients who's and families that are affected by the diseases. And what came from this was really a high quality guidelines for how the data will be collected and how it will be managed and assessed. And new technologies have been introduced to collect the data and to have it be in place for analysis. As well, the oversight of the study has taken into account the recent pandemic and how this has impacted patients' ability to travel, and also understanding what the burden is for families that travel. So we will be using technologies for virtual visitations and assessments in addition to some in-person assessments. And there will also be a very flexible schedule of assessments. So what is the difference from other natural history studies? As you may know, there are other natural history studies in process right now. And this one has, they all use a little bit of different protocols and may have different assessments. In general, most natural history studies are collecting diagnostic information as well as trying to assess the progression of the disease and age of onset. But as well, individual natural history studies may be utilizing a specific set of clinical assessments. And this one in particular, we'll talk about some of the assessments that are being used to look at the neurologic manifestations, both with regard to assessing gait and other types of neurologic assessments. The study is actually also going to collect not just retrospective data, but prospective data to follow the patient in real time. And there will be a long follow-up of patients for 48 months. And we hope that this length of period of time will also provide a lot more information to be able to provide excellent data. So what are the study assessments? These assessments in general include some visits with the site and the principal investigator. There'll be a detailed clinical history that will be taken from the patient and the family. That will include the diagnosis, the method of diagnosis, the onset of the disease, the age and the symptoms, as well as what the current status is at the time. And also collect any information on any kind of intervention that may have been provided to the patient. There will be some consideration into the impact of the disease on the daily life of patients and caregivers using questionnaires about the patient's behaviors and quality of life and the caregiver's burden. There will also be an e-diary that the family will be trained on so that they can register any particular events such as seizures or choking episodes into this e-diary in real time. And then there's also sensor data. A sensor will be attached to the patient's body to allow collection of information on daily moving and also the daily impact of the disease. So all of these assessments will come together and provide a more accurate picture of the disease progression. This is looking at what the schedule of assessments is that the site will be following. And as you can see, the baseline study or the baseline assessment for the study will include an informed consent process and as well as looking at eligibility to ensure that the patient meets the requirements of the diagnosis and age, for example, to participate in the study. There will be a medical history, an assessment of neurologic milestones, an overview of medications. Two of the clinical assessments that will be done will be the ataxia evaluation, which is the SARA, and also the INS, which is looking at other non-ataxia types of neurologic manifestations that are not part of the SARA assessment. There will be a swallowing assessment. Patients will be trained and their families on maintaining a diary of changes, and also there will be instruction on the sensor. So this first baseline study will be done in person at the site. And then there are periodic assessments that are done, and you can see the intervals at every 3 months, and then eventually every 6 months to the end of the study. And most of these will be able to be done on a virtual basis. We will ask for the family to come back on an annual basis to have some of these clinical assessments performed by the principal investigator. So why is this important? This is a very important study, and it's important information for the community and to inform those that are conducting clinical trials of interventions. It provides very crucial information to help design clinical trials and to understand what the need and really the unmet needs may be. And it allows, I think, for us to also, or for the organization to identify the virtual sites and the key opinion leaders, the experts in these diseases, to determine optimal sites for the clinical investigation aspects and for the future interventional trials. It also gives information about how useful the assessments may be and how practical they are to perform, and also understand the aspects of this natural history study that involves the inclusion of patients contributing with, for example, the e-diaries and the sensor information. In particular, this trial will be important for the intervention study that Azafaros has planned for GM1 and GM2 as well as NPC. And it will inform, at least for GM1 and GM2, what the natural history will be, and we'll be able to compare outcomes within intervention to natural history in order to have good information on effectiveness of these interventions. So looking overall at kind of the plan for development of the clinical trial by Azafaros, first, when there is a, in preclinical trials with studies, I should say, that are conducted in animals and generally in mice to begin with, also data from cell-based studies are used to look at and identify prospective compounds or to help design compounds that could potentially be beneficial to intervene and change the course of the disease. These compounds are then tested in a phase 1 type of clinical trial, which is really designed to determine safety and also dosing. They try to understand the pharmacokinetics of the drug in humans, how the drug is processed, what kind of levels, if you can measure the blood levels, and where does it get to in the tissues, for example. In general, phase 1 studies are done on adult patients before coming into the pediatric world, but not always, but that is a frequent process. And from there, from this information, we typically will move into phase 2 studies in which patients with the diseases will be tested. And again, there'll be more safety testing, but there'll also be some early efficacy data to look at outcomes, and there'll be more fine tuning of the dosing and the intervals for dosing and the absolute dose levels, for example, and possibly also be looking at more biomarkers for assessments. And then phase 3 studies, this is when we get to full testing in patients, looking at efficacy and both short-term and long-term. And this is when it will be really important to be able to compare as well to natural history of disease. So at this time, there has been progress through the preclinical and the phase 1 studies, and now the company is in a phase 2 study. So a few patients are being tested with the drug, the new drug that's been developed, to test for safety and adjust for dosing. So the new study is called the Rainbow study. This will be open shortly in the US, and my understanding is it's opening in Brazil. They'll be registering for this study right now in PC and GM2 patients only, 6 patients in each disease. GM1 is not currently in this study because of the lack of data, and this will be, it'll be important to get more preclinical data first, as well as the natural history data. But eventually, hopefully, that will be the trajectory. Patients will be taking this medication orally. It's 5 capsules in the morning. It will be for a 12-week period of time. And there'll be a screening period prior to this main study of approximately 4 weeks where clinical assessments, including laboratory studies, will be done. And they will, in the main study, there will be placebo and also several different dose levels, and 2 different dose levels. And there will be an equal randomization that is blinded of 1 to 1 to 1. So each patient that enrolls on the study has an equal chance of placebo, the lower dose or the higher dose. So as mentioned, the phase 3 study is the ultimate goal, and the company is currently working on the design of these studies, and ultimately they will plan on opening 2 studies in GM1 and GM2, as well as NPC. These will both be international studies and will be, again, focused on the late infantile and juvenile forms of the diseases. And it is anticipated that these studies will open in the second half of 2024. And thank you very much. And at this time, we welcome any comments or specific questions related to the natural history study or even the future Rainbow study.